Our posture procedure is an innovative technique used to treat osteoarthritis and chondropathy. This was first introduced in the early 2000s by Dr. Gobbi and refined with up-to-date scientific evidence. POSTA stands for platelets adipose stromal treatment for arthritis. This technique utilizes a combination of platelet-rich plasma, or PRP, derived from peripheral blood, and MSCs from stromal vascular fraction, or SVF, which is sourced from microfragmented adipose tissue. By combining the two, we take advantage of MSC's ability to stimulate cartilage regeneration and improve joint symptoms, as well as synergistically with growth factors and cytokines from PRP to further enhance the healing process. The posture procedure is simple and can be done in an outpatient setting, utilizing locally administered anesthetic and vasoconstrictor. We start by collecting 15 milliliters of venous blood and centrifuging to obtain our platelet-rich plasma. At OASI, we ensure the quality of our products by analyzing our blood and prepared PRP using an in-house hemoanalyzer. Once PRP is obtained, we transfer it to a sterile syringe for later mixing with SVF. For adipose tissue collection, patients are placed in supine position for abdominal collection or prone position for supragluteal collection, and our prepared Klein solution of local anesthetic and vasoconstrictor is administered to the harvest area. Following infiltration, we allow 15 minutes to ensure that the harvest area is anesthetized and bleeding controlled. Once the area is anesthetized, lipoaspiration is done using a 3mm lipoaspirate cannula connected to a large volume syringe. Once the adipose tissue is collected, we position each syringe upright to allow proper separation of the adipose tissue from the other aspirated elements. When the adipose tissue is settled at the top of the syringe, the dependent fluid and tissue elements are discarded. Typically, we harvest 30 milliliters of fatty-rich lipoaspirate per injection site. Once the desired volume of lipoaspirate is collected, we transfer the tissue to an Arthrex ACP double syringe and centrifuge at 2,500 rotations per minute for 4 minutes. This allows separation of the different fractions by gravitational and centrifugal forces, giving us 3 distinct layers. The oil fraction is aspirated using the inner syringe, and the aqueous fraction is drained by removing the red stopper and disengaging the inner syringe, allowing the aqueous fraction to drain spontaneously. The remaining condensed lipoaspirate is then transferred back to sterile syringes and undergoes microfragmentation. Microfragmentation is done by passing the condensed lipoaspirate 30 times between 2 syringes connected by a 1.4mm female Luer lock connector. After microfragmentation, the contents are then divided into 2 ACP double syringes and, using the same parameters as before, undergoes a second centrifugation. Again, 3 distinct layers will be formed: the oil layer, the SVF layer, and the aqueous layer. Take note, the aqueous and oil layers may not be as abundant or distinct compared to the first centrifugation. Only the topmost oil layer is then aspirated using the inner syringe and discarded, and the SVF and small aqueous layer is transferred back to sterile syringes. These contents are then mixed with the previously prepared PRP, and the final solution of PRP and SVF is administered to the patient. The procedure should take approximately 30 to 45 minutes from start to finish, and post-operatively, we typically apply compression over the abdomen and injected sites to limit any post-op swelling and bleeding.